Nurs210 assessment for Class 210. Items that are being used. Alright, Ms. Nikki, if I can have you walking toward me in a normal fashion, and then go heel toe, get to about this point for me. Stand with your arms at your side, with your eyes closed. This is the Romberg test, and there's no abnormal swaying or balance or equilibrium problems. Open your eyes for me and bend and touch your toes as far as you can. Testing for scoliosis or any other abnormalities of the spine, and everything is intact. Have a seat, pull your sleeves up for me, please. Checking for skin on the arms and legs. And the arms are normal hair distribution. Also checking for joints as we go down. All the joints are fine. Nothing abnormal felt, no pain felt in any of this. And the wrist, finger joints are fine. The wrists are fine, no cracking. Can test for dehydration. Can test for capillary refill, and that was the Turker test. Nail beds are firmly attached, or nails are firmly attached to the nail beds. No problems with that. No problems with the knees, no really abnormal swelling for there. Awesome. Nothing for there. Normal hair distribution for female. And Turger is good there. We cannot test capillary refill of the toes because of toenail polish. Okay. We're gonna, I think we did, I'm sorry, I'm trying to get my head straight. I'm talking too fast again. Alright, since you are sitting, I'd like you to use the rapid movement of the hands. And stretch out your arms, touch your nose with the finger, touch the other nose, do it with your eyes closed, and we have no problem for that. Go ahead and relax for a minute and borrow me one hand. I'm going to put an object into your hand. I need your eyes closed. I want you to let me know what that object is. Go ahead and close it. What is that object?
Feels like a penny.
And it is a penny. Keep your eyes closed for me. And I'm going to write something into your hand. And I want you to let me know what that is. B. That is also correct. I'm going to also borrow a arm for here. This will be sharp. And this will be soft. Also, when I touch you, I'd like you to point to where I'm doing this touch, as well as let me know if it's sharp or soft.
Okay. Sharp. Smooth. Smooth. Sharp.
Great. That is fabulous. Alright, I'm going to do some testing this way. This is the Weber test. Can you hear that?
Yes.
Can you hear that?
Yes.
Can you feel that?
Yes.
Can you feel that?
Yes.
Can you feel that?
Yes.
Fabulous. To inspect your head, the shape and symmetry is fine. The hair is fine and clean. There's nothing abnormal in the scalp, no lumps and bumps for that. Going to check for your sinuses, your paranasal sinuses, checking for frontal ones. Maxillary, any pain for those at all? Alright, going to do your temporal mandibular joint. I need you to open your eyes, or open your jaw for me. Okay, swing it from side to side for me. No crepitus or anything else felt for that. Alright, now clench teeth together, real tight. Alright, blow with your cheeks. Do purse lip for me. Make your eyebrows go up, make your eyebrows go down. Frown for me while I keep this on. I'm going to also inspect your mouth at this time. And grab a light to do this inspection with. Open for me your mouth. Stick your tongue out. Swing it from side to side for me. Swing your jaw from side to side again, just in case they didn't see that. Alright. Open, stick tongue out. Say ah, ah. Good. The upper soft palate didn't move. Checking for your ducts. The ducts are fine. Under the tongue duct is fine as well. And the teeth are fine, and the lips are in pink color. Alright, going to now inspect for your nose. I'm going to take my thing back again. And check up your nose. There's nothing abnormal out there that you'll see appear to be clean there. There's no breakage or anything noted in that. Okay, please close your eyes. We're going to test for cranial nerve 1, which is olfactory. Can you smell that?
Mm-hmm.
That's great. Alright, you can open your eyes now. I'm going to do some things for visual acuity wise. There's one called the Snellen test, and we are testing for far vision, which Snellen test would have a bunch of E's in different ways on them. You would be standing about 20 feet away from the test, reading from top to bottom. If you can only read down to line 20, that means you have 20/20 vision for that. Then the Rosebaum test is for reading for nearsightedness. Again, I would give you something to read. You'd read from top to bottom so we can test for that. And then you're going to test for peripheral vision. Here's my pen. And cover the same side as I am. I'm going to come around you. Let me know as soon as you can see that. And
I
again.
can see it.
And once more. Right, our peripheral vision is just as well. I'm going to also keep my pen here and follow my pen. Just movement with your eyes. We're testing for the eye muscles. This is our letter H. Testing for our 6 positionings of the eye. Alright, now we're going to do our cover and uncover test to observe for pupils. Good. And uncover. And there is definitely a reaction. Because this pupil here is about a 3, and this starts at a 5 and goes back down to a 3. Now I'm going to also inspect the eyebrows, which are fine. The eyes are fine. I want you to go ahead and try to lift up for me on that. So the eye muscle on that is fine. Pupil response is what we're also checking for. Again, we're going to get this and turn on a light here. Thank you. Definitely have a response. Again, I'm going to look at your other eye for like accommodation wise, and they both react accordingly. Oh, I'm talking too fast again. I also like you to gaze at something in the distance here. Could even be as far as there, and then come and gaze at this down here. And we definitely have the adjustment going on for the eyes. I'm going to put this back down and also need to check for your tear duct areas here. And we're good. Alright, let me switch out the top of my thing here. And get it to unscrew. And I'm going to gaze into your eyes to see if we can see the inner workings of your eye. Going to get really close with this, almost at touching your eyelashes. Can see. Good. I'm going to switch out my top again. And also want to check for your red reflux here, which I found works much better with this. Definitely we have that red camera glow going on. Now I'm going to check your ears. I'm going to keep taking this off. We've got good inspection, everything's equal. Symmetry, we're going to only check into one ear. Most of this test will be only testing one side, just for fact of time. Alright, let me check in. Well, we definitely have some wax, but clear through, nothing red. You can see the tympanic membrane, and everything looks good. Let me turn that back off. Alright.
I'm good. How are you
There
doing?
is our whisper test. Alright, going to check your neck, and we have good symmetry. Your cervical spine is fine. Let me palpate for your lymph nodes, which your occipital lymph nodes are good. Your articular lymph nodes. You got your submental lymph nodes, your submandible lymph nodes, and your sublingual lymph nodes. You also have your posterior and your anterior. And if you could shrug your shoulders a little bit, and we have our deep ones. No edema felt throughout those. We're also going to palpate for the rest of your neck. Go ahead and relax your shoulders. The trachea is within range. Don't feel anything with the thyroid. And we can feel our carotid artery just fine. I'm going to go ahead and listen. Normal sound from the carotid. And don't hear anything in toward the thyroid ring. Alright. Now, I'd like you to bend your head forward. Bend it back as far as you can. Bend to one side, bend to the other side. Turn your head to the right, turn it toward the left. Alright, bring it forward again. No, right, just straight. I'm sorry, that was my fault. Okay, bring forward, and bring back, bring from the side, and to the other side. Alright, now I'd like you to shrug your shoulders for me, up. Alright, now come back down, do it again. Bring your shoulders up and around. We have good range of motion for that. Now, go ahead and bend your elbows up. Bend them down. Put your palms down. That's pronation. Palms up is the other way. Subation. Alright. Go ahead. Try to push against me. And again, push up against me. That's fabulous. And it's going to also check for your pulse areas. before I don't forget, since I'm thinking of it, we got good pulses in the temporal area. We know we have the carotid, we have our brachial, our radial, we have our popliteal, and we have, oh, that one's a good one too. And we have all our pulse points. It's going to sleep. All right, take your arms back out for me. Like you just go ahead and flex your wrist. Bring them back to neutral. Extend your wrist up. Bring it back to neutral. Bring your hands out. Again, flex the fingers down. Back to neutral. Extend up. And then hyperextend all for me. Come back to neutral. Bring through so you have radial deviation, ulnar deviation. And then we're going to do this again. Try to pull, bring your hand up for me, just at the wrist. Oh, just at the wrist. And back down just at the wrist. Fabulous. All right. Keep your hands out for me. Again, with the fingers, I'd like you to touch each one with the thumb like that. Great. Now we'll put in between. I'm going to try and pull them open as you squeeze tight. Again, try to open. That's great. I think we got all of that. Now I'm going to check for your lungs. All right. And palpate for the lungs. All right. Then I'm going to listen. I'm going to have you turn, so you don't turn so your back comes toward the camera.
Okay.
Again, I'm going to listen. All right. I'm going to do some palpation here. Place 99.
99,
99.
99,
99.
99.
All right. I'm also going to palpate and do some percussion stuff here. Take a deep breath for me. Hold it. And we just test for our diaphragm. You can flip back around for me, please. All right, going to then check for your chest, for your heart function stuff.
Okay.
And we're palpating to find the PMI, the point of maximum impulse, which is usually under your breath, so we're not going there. I'm going to listen to you. Going to the second intercostal space there. And this is the aortic side. Onto your other side is the pulmonic side. Coming down one space is Erb's point. Coming right into the sternal line is the tricuspid valve, and the midclavicular line about the fifth is where the mitral valve would be. And we don't hear any abnormal clicking or anything along that line. Alright, now going to check for your abdomen. I don't want to keep putting this in. Need to listen for your abdomen, but at this point I need you to please get into my fancy lay down there.
Leave it this far back or pull it up?
Okay. You may want to bring yourself forward a little bit. There we go. Alright, going to listen to your abdomen. Checking for the iliac vein, the renal artery, renal artery, and femoral artery. And you have good bowel tones there. Going to do some percussion here, so I can see, try to locate your liver. We're right into this zone. I'll make a mark. Sorry, making a mark with your shirt. We have our measuring tape. And we're coming down. And we are at 6.5, which is the normal limits, because normal is like 5 to 10. I'm going to palpate for your liver. Let's make it a little ticklish. May not be able to palpate. From what I can tell through laughing, the liver's in a normal zone. The spleen is tucked up underneath where it needs to be. I'm coming and I'm trying to get your kidney here. From what I can tell, everything's in a normal zone for that. Alright. Now, while you're laying there, please, I need you to lift your leg up as high as you can. Bring it come down without touching. Swing it out to the side. Swing it over to the other side. Put your foot onto your knee. No, just on the side of it. And then drag it down your foot. That's fabulous. Alright, again, bring your leg up for me.
Same one.
Mm-hmm. Push and push again. Bring your leg up for a knee. Bring your knee out. Bring your knee all the way into the other side. Now cross your legs like a man. Bring out. That's fabulous. Alright, again, bring your other knee up. I'm going to pull against you, pull in, and again push out. Bring your foot all the way down for me.
Oh, down.
Mm-hmm. Flex your toes like you're walking. That's plantar flexion. Up is dorsal flexion. Swing them in for eversion and inversion.
Okay.
Yeah, wiggle the toes while we're at it. One other thing we know we have to do here. Oh. Push up, push down. Alright. Now I need you to come back into the chair. So just for your reflexes. Got it. Okay. Alright. Need your elbow here. There we go. Going right here to test for the lower half. Excellent. Alright, just relax your knee for me. Good. And I
don't think they could actually see that though.
well, the knee one worked just fine. She done almost kicked me. And I think that concludes because her ankles are a little sore, so we're going to skip the ankle one.